Having experienced this with kidney stones, I like to think that people think I'm a man, but I've been told that it's right up there with child labour, giving birth. I have no experience of that, but I tell you what, if that were anything close to it, I would say I had triplets and they were £15 each. I woke up at about 5 o'clock in the morning and I just had this pain sensation in my lower back. How I would describe the pain, it was just non-stop. There was no let up, no relief in it. I thought it was terminal. I got all these thoughts go through my mind, you know, because if it's a physical wound, I could see it and I could deal with it. But when it's inside you, you have no clue how to comprehend what the heck's happening with your life. I mean, I made a decision to go to the hospital, told my wife to stay there, so I hopped in my work truck and started up the road. I've got a fairly big size van, so I'm pulling in and I just barely made it to the curb, stopped me. I did one of those cowering hobbles over to the main door, got in, and at that stage I just was reduced to my knees. I crawled over. Luckily there was nobody there because, you know, I felt like my pride was hurt if somebody had seen me, you know. This grown man on his knees going over to the reception desk. And the next thing I had my hand up and I'm shouting, please help me, get somebody out of here. And I said, I need something for pain. Something's going on, seriously, get me in there quick, you know. The diagnosis was kidney stones and they could not assure me how long it would take to pass the stones. The only advice they gave me was the fastest way to get rid of them was to drink a lot of fluids, especially water. Basically, their explanation was that the more water you can get, the more liquids will pass through your kidneys, and in doing that, it'll help flush the stone, you know, into your bladder, and then at that stage, then you can safely pass it. My only other option was to have it what they call blasted, and my urologist that I went to visit explained that in detail. That, you know, that they put some type of device on your kidney area, and then they send some sort of a signal in that blasts this meteorite out of it, you know. I didn't particularly want to go that way because they half assured me that I would pass it relatively fast, but it took a week and a half to do that. And in hindsight, if that were to happen again, I would immediately get it blasted. So lo and behold, I went to the bathroom and was doing my filtration thing, and next thing I popped this actual kidney stone. If I were to describe the size of this stone, one would imagine it should be like a football, but in actual fact it was probably about half the size of a pea. If I ever got my hands on that kidney stone again, my goodbye to it would be I'd put it on a nice little block, get the biggest sledge that I could get, or hammer, and smash it into smithereens.